everybody. And I'm going to go ahead and get started. We don't have a lot of time, but so I kind of packed my my slides with a lot of information, and you guys can go back to that information at your leisure and have a lot of information available to you for use for ongoing use. Okay. So just a brief overview of compression therapy. The origins trace back to ancient Greece and Egypt. And in the 19th century, we saw the development of more structured elastic garments, better support. And in the 20th century, we had improvements in textile technology and medical knowledge. And then in the 1950s, an engineer by the name of Conrad J., that was his initial for his last name, is recognized as the inventor of medical grade graduated compression garments. And this is what we are using today. And graduated compression, by the way, just means that it's stronger distally. So that means down by your ankle or wrist, and it gradually decreases up the arm or the leg. And today, and we're going to call these MCGs, they're available in various sizes, shapes, strengths, elasticity. They can fit all body parts, and they're meant for many medical and therapeutic purposes. So the positive impact of MCG use is evident throughout the literature, and they are the primary mode of lymphedema self-care and self-sufficiency. And they are used for many, many medical conditions. Of course, for lymphedema, phlebolymphedema, and lipedema, also chronic venous insufficiency, venous ulcers, post-surgical recovery, sports and injury recovery, and also as a prophylaxis, as a preventative. So how do compression garments assist in treatment and management? Well, first and foremost, they help you with your edema reduction process. They improve your lymphatic drainage, and they reduce that capillary filtration, which is leakage into your tissues. They enhance your microcirculation, very important for tissue health. They improve your venous return and decrease venous pressure. And they play a key role in maintaining the results that you achieved with your complete decongestive therapy. More mechanisms of action, they reduce that inflammatory response that is caused by lymphedema, by swelling. They help soften your fibrotic tissue. They reduce those pro-inflammatory cytokines, and that results in reducing pain and promoting wound healing. They reduce your edema, which allows for improving your quality of life. And the optimized therapeutic benefit of compression garments is achieved when patients exercise and move while wearing their garments. So it's really important. So there are many types of medical grade compression garments out there. Yesterday, we discussed short stretch compression bandaging. Today, I'm going to be discussing compression garments, stockings, sleeves, socks, toe caps. You see all kinds of things on this page here. We're going to be talking about each one of these. And then we have our channeled chipped foam garments. And then we have our adjustable compression wraps. And we'll talk about each one of these. So yesterday, we talked about that intensive phase of treatment. Phase 1, that decongestive phase. We're going to be focusing today on phase 2, the maintenance phase. So here's your maintenance phase: self-care, skincare, hygiene, self-massage, compression garments, and exercise with your compression garments on. Plus, I've added nutritional considerations, weight management, compression bandaging if necessary, and also people use pumps. They're called IPC devices. So compression garments, and this page shows you some pictures of some circular knit options and flat knit, and we'll be talking more about those. They can be custom fitted or they can be ready-made, also known as off-the-shelf OTS garments. These are usually worn after initial reduction phase to maintain that reduced limb size and prevent fluid reaccumulation. They're usually meant for day wear, and these garments are made for all body parts: your neck, your face, your genitals, your toes, pelvis, everything. Your channeled chip foam garments are also custom fitted or can be ready-made. They're usually worn after that initial reduction phase to maintain that reduced limb size, often used as a nighttime garment or a bandage liner, and they help soften that superficial fibrosis. And then there's the adjustable compression wraps. There's all different kinds. They're actually a little easier to don than compression garments, and they are important because they can be used in both that reduction phase and also in that maintenance phase, and they are safe for day wear and night wear. So now we're going to talk about the components of medical grade garments, the textiles, what makes up these garments. So today, these garments are breathable, moisture wicking materials and meant for extended use and for comfort. They are usually a combination of cotton, silicone, nylon, Coolmax, and spandex. The knitting and weave methods today are divided mostly into either circular knit, flat knit, or cut and sewn, also known as a warped knit. So we'll be talking about each one of those. Each of these garments has its own unique advantages and disadvantages as it relates to an individual's edema presentation. So circular net, that's probably the one people are most familiar with. You see how they're just basically a tube-like shape. They're generally very sheer, soft, stretchy, smooth, thin, and they are actually mass produced. They're generally you're ready to wear. And they actually lack in stiffness though, so they often will rest in your skin creases. So what is stiffness? So flat knit is a stiffer garment than circular knit. And stiffness is actually the resistance of the garment to expansion and swelling. So stiffness is really critical in a garment. It provides a higher level of containment. That word containment is an important word. It's better at bridging your skin folds. They're less likely to cut in or create a tourniquet effect. And they have more precise targeted compression levels. They are made to fit your shape. This is just more examples of flat knit garments of various shapes and sizes. They can be made to fit anything. And here's your cut and sewn. This is a very durable fabric. It's a precise gradient compression. It's very suitable for those unusually shaped dimensions. And this fabric does vary in stiffness. And I often use cut and sewn for my PD clients for their hands. I think it accommodates the hand swelling really well. So this is just a side-by-side comparison of pictures of your flat knit, your circular knit, and your cut and sewn. And that's actually a PD garment there, that one on the right. And here we are with adjustable compression wraps. And you see on this leg, I have two different types on there. I mix and match my garments. It's okay to mix and match your garments. So this fabric is actually stiffer than flat knit or circular knit. It can be used for that fluctuating edema, also to reduce your edema and for maintenance. It is a decongestive garment, and the textile is usually a Velcro sensitive neoprene. And here we have channeled chip foam garments. These are textured materials meant to soften fibrotic tissue and enhance that dynamic compression effect. They're usually a combination of polyester, cotton, spandex, and Coolmax. They are usually worn at night. And their purpose is very important. They prevent that rebound swelling, because a lot of people have rebound swelling at night. They maintain volume reduction, and they address those soft tissue changes that are occurring. So, the strength or dosage of the fabric is referred to as mmHg. That means millimeters of mercury, and that's the pressure on the skin. And the strength refers to the garment's ability to provide that intended level of compression over time with usage. So your quality, well-made garments will hold their strength over several months. Your lesser quality garments will actually fatigue very quickly, so they actually have less therapeutic value. So, and then also sometimes choosing a stiffer textile, remember that word stiffer garments? Sometimes choosing a stiffer textile versus increasing the prescribed dosage may actually have better outcomes for some patients. So compression levels are also referred to as class again and mmHg, and different countries have different classification systems. They all vary a little bit, but on the right there you see the US classification system. So for instance, a class 2 garment is also known as a 20 to 30 millimeters of mercury, a very commonly prescribed garment. All right, choosing the right garment. This is a really tricky business. There's a lot of variability and sometimes it takes several trials to get that just right garment. So you need to be patient and really manage your expectations. But many things must be considered. You need to consider the severity of swelling, the person's range of motion, their hand dexterity, do they have pain, their age. Cognition plays a big role in this, finances. A lot of things play a role in proper fitting. So there's a thing out there called STRIDE. It's an acronym. The letters stand for a key group of considerations when selecting a compression garment. A group of very smart people put this together, and they're actually expanding on it. So basically, they came up with an algorithm chart that incorporates both the textile characteristics of the garment and the edema presentation of the patient to optimize that medical garment selection. So these things need to be taken into consideration. And we're going to talk about texture of the edema. But STRIDE looks at the shape of the arm or the limb, the refill of the edema during day and night, how quickly it refills, all the issues, the dosage, the strength, and the etiology, what causes the lymphedema. So the tissue, that's the T in STRIDE. It's divided into these four categories: watery, fatty, putty, and woody. And we see all of these things with lymphedema and swelling. So those feet down there, they are actually in that putty, woody stage. And that upper left picture, that's actually a thigh. That's actually a fatty, watery stage. So when it comes to choosing the right garment, it's very important to match the tissue type of the client to the appropriate textile characteristic. And on this slide, I kind of talk about each characteristic of tissue and what type of garments would be appropriate. So this is for your use. But, like tissues that have rapid refill, those require higher levels of containment and those require nighttime compression. But your soft, pliable, watery tissues, they can be easily managed long-term with a circular knit garment at a lower strength. And so for new users, for my patients, I start with lower compression levels and I gradually increase as tolerated. And that's for new users. And we like to talk about using extra wide bands and silicone bands and adhesives. These help reduce that slippage and rolling. But slippage is normal. It does happen. All your clothes slip. It's normal. But it must be fit properly to be effective and comfortable. And compression garments should encompass all areas for edema. And then the golden rule of compression garment selection is that the limb and body part must be in a decongested state, basically minimal to no edema, prior to measuring and fitting. Putting a garment on a puffed up, swollen limb is just really not a good idea. All right, maintenance considerations. Garments do fatigue just by your body sweat, by washing, the sun, oils, all these things cause them to fatigue. So, if you're wearing them daily and alternating with a second set, it is recommended that you replace them every 4 to 6 months. This is critical. Once they're fatigued, they may look good, but they're not doing any work for you. And it's best to have two sets of garments to allow for cleaning and rotation. And for people who've been wearing custom garments, just keep in mind that new custom garments are like a new pair of jeans. The fit of your new garments will feel different than your previous old garment. That's just normal. So when you buy a new pair of jeans, they do fit differently than your old pair. These are just key precautions and contraindication considerations. So basically, persons with underlying health conditions should consult with their healthcare providers before using medical compression garments. We need to take in consideration blood clots, peripheral artery disease, kidney disease, congestive heart failure, and other medical conditions. And some people have fabric sensitivities and allergies. You need to maintain really good skin hygiene and wash your garments frequently and inspect your skin. All right, some application tips. So, very importantly, medical compression garments are a 2 times a day, 7 days a week commitment. So you have to commit to your garments for them to be effective for you. And so ideally, you would put your compression garments on while you're in a fairly decongested state, which is usually first thing in the morning before you get out of bed and start moving around. You want to make sure you're applying your garments to nice, dry skin. So don't take a shower, dry off, and try to put on your garments. Not a good idea. It's best to shower the night before. Turn your garments inside out partially when you're trying to don them. So for a foot, I turn it inside out down to the heel, so the inside of the heel is showing, and then you slide in a nice dry foot. I like to put a little powder on the foot into that heel area, and then pull the rest of the garment up over the heel, and then you're fairly golden getting it up your leg. And then for the arm sleeve, I turn it inside out by a half to a third. Again, I slide in a nice dry arm hand up over to the wrist, and then I slide the garment up. And ideally, when you get new garments, especially your custom garments, you want to wash and wear that new custom garment at least 5 times for 5 days to get the actual fit. Don't expect that garment, that custom garment, to fit you beautifully on the first day. You need to break it in. And use textured rubber gloves to help you get on your garments. There are many donning and doffing assisted devices available, and the next speaker will be addressing that. I just put in a picture of some of the devices that I keep on hand and recommend to my clients. So in conclusion, medical compression garment therapy is an effective and essential component of lymphedema self-care management and your self-sufficiency and independence. It is important to consult your healthcare professionals for guidance. Your success depends on correct application, appropriate type of compression, very important, proper fitting, patient education is also very critical, and then adherence. And the medical compression garments are most effective with movement and exercise. And when used correctly, they do improve your outcomes, they maintain your reductions, they reduce your symptoms, and they enhance your quality of life. So now we have time for questions.
Great. Well, Vail, we have lots of questions for you,
Oh,
but I will
okay.
say that that I just have to make a quick note that there's some people asking for some specific guidelines, and unfortunately, if you're a new compression garment user, it's very hard to give specific guidelines because everybody is different, and so it's really important that you connect with a lymphedema therapist who can formally assess you, as well as take a look at the swelling, make sure that you are fully decongested, as Vail had mentioned, and getting the appropriate garments for you. Fitting is a different story. Some therapists fit, some use fitters, but it is really important that you connect with a lymphedema therapist. They can certainly guide you to specifically what you need. So, okay. So a couple questions here. So if someone has a compression garment on their lower leg and they're noticing that it works very well, but then they're noticing knee and thigh edema, what are your recommendations?
So just to clarify, they're wearing a knee high, but they're starting to notice some thigh edema.
Correct.
Okay. They may or may not still be in therapy. And sometimes if you're not in therapy, it's hard to reach back out to your therapist in a hospital setting. In a private practice, you probably could reach out and they'll just advise you. But one thing I would start with is reaching out to your therapist if at all possible. And sometimes the thigh edema could just be, you're just getting some reflux edema in there, and you might want to try out capri style shapewear to assist with that. Or your therapist may suggest, depending on the type of edema, they might suggest some type of compression garment, like a custom garment. I like personally to go with the capri style and knee highs, because versus a pantyhose style, it's so much easier to get those on. And when you're wearing like a full-length pantyhose style, every time you bend your foot and walk, it pulls the entire garment down. So when you go with a capri style and a knee high, every time you walk, your garment isn't slipping and sliding down, so you're not having to pull it up. But typically for a lot of my clients, I'll go with some type of shapewear first. Again, I start with something lighter that's tolerable for them. And then if they need more containment, then we'll start looking at a custom product. But, I should say, if the thigh edema is suspicious for like some type of malignancy or some type of mechanical blockage in the groin or something going on in the abdomen, then your doctor needs to be made aware of that. And probably, you want to rule out some things too. If you're at risk for blood clots and all those sort of things.
Absolutely. Yeah. Can you comment on layering compression garments?
Oh, yes, big fan of layering. It just makes life easier for everybody, actually, and especially for the patient. And um, I mix and match different types of companies and products, and there's so many, there's so much out there now. And again, all garments have good qualities for some people and some qualities that aren't appropriate for some people based on texture and tissue type, right? So some garments address different types of things better. So like the Velcro garments on that patient's leg that you saw there, that particular garment, that was a Velcro wrap type garment, but on the lower leg of that person, his tissue was very dense and hard. I mean, it was just woody. It wasn't even putty. It was just woody. So he had a very aggressive Velcro wrap on the lower leg with a chip foam product underneath it, actually. And then on his upper leg, he had a lobule on his thigh, and it was not woody. It was more putty-like. And but the tissue was more soft and putty. So we used a lighter Velcro type garment on that. And he reduced beautifully. And then, and we used that as his reduction tool because that actually stayed on him better than compression bandaging. And he had a large belly, so he couldn't really wrap himself, but he could get on his Velcro wraps. So two different types of Velcro wraps we used on there. And then as he reduced enough, we eventually put him into custom flat knit, and he wore custom flat knit capris to encase that lobule, and then a knee high. And it's very important with lobules. Lobules will pull your garment down. They will pull your garment off your booty. So you need to have a good shelf on your booty to hold up your garment. And you do not want to wear a pantyhose style with lobules because they will pull your garment down. And then I mix and match products too. So like on many children, I will use a custom seamed on the hand, a custom seamed or a I forgot the other name for it, a cut and sew on the hand because it can accommodate their shape of their hand better. It's easy to get on. And then I will use like a circular knit on the arm. Just, yeah, mix and match.
Yeah, and again, talking to your therapist to determine what types of garments is going to work best for you. And I know that this is a huge topic and a very important topic. Not that they're not all important in this event, but we are hoping to bring another webinar that focuses specifically on compression, so we can go into that with a little bit more detail. All right,
Yeah.
and then last question is, when is the best time to be fitted for a garment while you're receiving treatment?
Well, that really varies with each patient. It varies. You remember the T in there for texture. So if you're watery versus putty versus woody, the watery people, they reduce very quickly. And so they can usually get fitted, I would say within 2 weeks sometimes. If they're being wrapped, they reduce very quickly. Your woody putty people putty people, it just sounds kind of odd, but putty people actually reduce pretty quickly too. So maybe within 2 or 3 weeks of treatment. And then your woody people take a lot longer. Your really advanced edemas take a lot longer to get fitted for garments. And then for some of these folks, we'll actually use a Velcro wrap system versus compression bandaging. And we'll also use the Velcro wrap system because it can be part of their treatment, but then it can be their maintenance product too for some people that they can just transition and just keep using their Velcro product. I evaluated a patient the other day, mostly sort of that watery stage. And I wrapped her during our first session. Nice reduction, a very nice reduction. I just wanted her to go home with something. So I gave her just a ready-made circular knit just to contain her because we don't have time to wrap at this moment in time. We will revisit that just to see how she did. So it really, really varies. And so that's why the therapist needs to get their hands on you. They need to touch your tissues. People reduce at different rates, but ideally you want to get some good reduction in. And that's why we measure, by the way, a lot. I measure weekly. Sometimes I measure twice weekly, because when you start seeing that the numbers aren't going down anymore, that's when you need to talk about getting measured for a garment. And you have to think ahead when it's going to be a custom garment, because that can take time to get that garment in. I'm lucky here. We have basically a 1-week turnaround. We have excellent fitters, so.
Oh, that is excellent. Great. Yeah, as you can see, there's so much more that we could talk about. And Vail, you did a great presentation, and thank you so much for being here.
Well, good morning, everyone, and thank you, Jen, for the introduction. As Jen said, I'm an occupational therapist certified in lymphedema, and I work in upstate New York. And I'm here today to talk to you about donning aids for applying your compression garments. So the objective of my talk will be that you will all learn and understand the variation of donning aids and techniques so that you'll be able to select the most appropriate donning aids to utilize as you need. I'll talk a little bit about each donning aid, and then I will show you a video of how to use that aid. But the first thing I want to talk to you about is what I would call a 2-ply method. In my experience, I've seen many people make the mistake of bunching garments to don, but the 2-ply method greatly eases the donning process. Is a 2-ply method when applying compression garments. This is a lower leg stocking, and what I mean by 2-ply is that we're going to fold the top half of the garment over, so the top half is inside out over the bottom half. This is an alternative to bunching the garment, which is probably what a lot of people do. When bunching the garment, you can see how many layers of fabric I'm trying to pull apart, and it's very, very difficult. It's also very uncomfortable when trying to pull that up over a swollen limb. So the 2-ply method, I am going down to about the ankle on the sock, turning the top half, all that extra material from the top half of the stocking, inside out. So now you can see there's only 2 layers, and I can stretch that much further. I can still see where the heel should be. So using those 2 layers, I'm going to be able to hike that up over my heel much easier. And then I'm going to proceed by taking a few inches of the material at a time, and I'm able to pull that up easier. The first tool I want to talk to you about are donning gloves. And if you've not used these before, these are a game changer. The gripping material of the gloves helps to redistribute and smooth compression fabric. Manufactured donning gloves from Jopes, Medi, or Juzo can cost up to about $20. But some of my patients have purchased gardening gloves for cheaper, and they also work. So another trick of the trade is to invest in some gardening gloves or donning gloves. And these you can find as, pretty cheap at like Dollar General or Walmart, or you can get the manufacturer grade donning gloves as well. So these are really good for getting a hold of your compression material to help pinch it or slide it up and down so that you can get rid of those wrinkles. Slip sock applicators help the initial donning of the stockings over the foot and ankle. They do, however, need to be used with open toe stockings. They're very durable and easy to use, and the cost is usually under $10. The next tool I want to go over are slippies. Every company has their own material or their own design, but essentially they're pretty small, they're pretty affordable. So these are usually less than $10. This one here is made out of like a paper material, and you see this one's more of a silk material. So to use these, you have to have open toe stockings. You're going to put your foot in the slot. Again, here's an open toe stocking. And now we can just slide it right over the heel. And I'm using that technique to try to pull those stockings up. When you're done, you just pull the end and it slips right out. Most of you already may know about sock aids. These come in a large assortment of shapes, sizes, and materials, and they're great for people that can't reach their feet. These can be used for open or closed toe stockings, and there are some that are developed for arm sleeves as well. These sock aids usually run between $10 and $30. So the next tool I want to talk to you about are sock aids. You might be pretty familiar with these. They come in all kinds of different sizes and materials. These are hard plastic, but there are some that are softer fabrics as well. This is just one that our hospital gives out, but you can find them on Amazon, relatively inexpensive. The tricky thing with the sock aids is that once you get the compression stocking on, it tends to pinch in the sides, which is why some of the fabric ones might be more comfortable for you. So to put this on, the ropes go towards the back like it's the heel of your foot, and you put the stocking on just like you would your foot if the end of the sock aid was where your toes would be. So sometimes this does take a little bit of effort to pull that stocking up. So you want the stocking toes to go right towards the end. This is probably easier to use with closed toe stockings, but you could also use open toe stockings with this. The nice thing about these sock aids is they're great for people who can't reach their feet because of back or hip or knee issues. So you're gonna put the sock aid on the floor, put your toe right in the opening, and try to shimmy your foot as forward as you can. And then you're gonna point your toe, pull the rope, and then flex the heel and ankle so that the stocking gets over your heel. They also make similar sock aids for putting on sleeves. So you do the same thing, pull the sleeve on, and then pull it up over your arm. The Arian Easy Slide is one of my personal favorites. It's very easy to use, but again, it has to be used with open toe stockings, and it can be used with sleeves as well. The cost ranges between $25 and $35, depending on if you purchase the arm Easy Slide or the leg Easy Slide. The next tool I want to talk to you about is the Arian Easy Slide. And this is really nice. They make it for a stocking or a sleeve, but again, it does have to be open toe. So it's pretty similar to the slippies, but you would put that over your foot. And then the stocking slides pretty easily over. Oops, that one went too far. But you can see how easily it slides. And then once the stocking is on, you pull it right out. So you can also do this for a sleeve. This is shorter than the arm Easy Slide. The arm Easy Slide comes up higher, but it's the same concept. So you can turn your sleeve and use that 2-ply method. You would put on the Easy Slide, and it slides right up. And here you can attach this to a doorknob, or somebody else can just pull it, or you can pull it, and it slides right out. The sleeve or stocking applicator can be a metal or a plastic frame. There are many versions of this on the market that can be used with open or closed toe stockings or sleeves. And this cost usually varies between $30 and $60. Another tool is a stocking applicator. And again, some of the brands make these for arm sleeves as well. This you're going to do kind of like a sock aid. You're going to pull that stocking down the inner frame. So it's opening up that stocking for you until you can see the toes. And then you would put your toe right in that hole. And this one's a little small on my calf, but you'd essentially pull it up kind of like the sock aid and then readjust. The Sigvaris Dolphin Donner is a really neat tool. It makes the process of getting stockings over a foot and ankle very quick and smooth. However, it does need a little, it does require a little practice to get a hang of it. It can be purchased as a single donner, which is just the blue part, or it can be purchased as a cone and donner combo, which is the black tall cone is what you see in the picture. I would highly recommend getting the cone with the donner if you're interested in this, and it can be purchased for around $100. So the next tool I'm going to show you is the Sigvaris Dolphin Donner. So this comes, you can order the Dolphin Donner part, it's pretty squishy. You can order this separate, or you can order it in combination with a cone. And it's a large cone that you would pull the stocking on over the cone. I'm going to use my arm because I don't have the cone. So you pull the stocking on over the cone, and it would be sticking up like this. And then you would put the Dolphin Donner, roll it onto the cone. There you go. And then you'd fold your stocking up over it so that the end of the stocking is at the end of the Dolphin Donner. And then you roll the Dolphin Donner so that it's kind of rolling the stocking through and into the inside. And you roll it until you get to the end. I'm gonna say it works better with closed toe. An open toe was a little bit trickier to manage. So here is the heel, and here's the end of the toe seam. So I'm gonna line it up along my toes where I know the heel is on the bottom, and it's gonna roll back over your foot and your heel to get it over your heel. If you like the idea of the sock slippies but prefer closed toe stockings, the Slippy Gator is a great option. This tool can be purchased in the form of a single donner, which is the white part, or in combination with a foot pad that it uses friction and leg movement to help coax the stocking over your foot and heel. The cost is between $16 and $40, and unfortunately I don't have this tool, but I did pull up a video that we can watch.
First, slip the device into the stocking, stopping just before your heel. Lay the Slippy Gator on the easy pad and insert your foot until your heel is just inside the device. Then slide your foot in a toe-to-heel rocking motion on the Juzo Easy Pad. You'll feel the pad gripping the stocking. Keep rocking your foot until your toes reach the beginning of the heel. Then stop. Pull the tabs of the device and work your toes through the elastic end. Please remember, no heel pushing in this step. Next, use the heel slide motion and pull the device up past your calf. You can also use the slippy to take off your stockings. Simply slide the elastic end up and over the ankle. Then pull the stocking down and under your heel. Pull your heel backwards on the pad until the stocking is off. Slippy Gaiter and Easy Pad are purchased separately.
That concludes my talk about donning aids and techniques, but I also wanted to bring this handy tool to your attention. You can likely all relate to the struggles of getting compression garments on, but that's only half the battle. Getting them off can be just as difficult and uncomfortable. So another favorite tool of mine is the Medi Butler Off. This tool can be used to doff compression stockings with ease. It costs between $20 and $48, but this tool is well worth the money if you struggle to get stockings off. So the next tool I want to show you is the Medi Butler, and this it looks like a shoehorn, and you're going to use it kind of like a shoehorn. So here you would push that rounded edge down into the stocking behind your calf. This this little point here catches the stocking to prevent it from shearing or poking a hole, and you just push the layers of the fabric behind and around your heel. If that happens, it's okay. You just restart until you can push it all the way off. This is a list of some of the official manufacturer videos for the utilization of these tools. I also have a handout that, Jen, I can put it in the chat, or if you want to email it to them all later with the presentations, we can do that.
Yes, it will be available on that that website that we'll be sharing that has everybody's presentation on it. So it'll all be together.
Perfect.
Well, great. Thank you so much. We do have a couple of questions here. Do you have any recommendations for removing custom compression garments?
For stockings, I would definitely use the Medi Butler. I love that all the edges are rounded, so it won't cause any tears or pull any strings. It might take a few rounds. If you saw in the video that I had to push down, one layer came off, and then I had to go and do it again to get the remaining of the material around my heel. So you might have to do it a couple of times because that material is thicker, but I think the Medi Butler does a good job of like protecting the garment as well as pushing it off.
Okay. I know that sometimes that the Medi Butler Off is recommended for circular knit. So I was just curious if you had come up with any other ideas for doffing.
Yeah, you can also use that 2-ply method in reverse. So grabbing the garment from the very top, and instead of bunching it down your ankle or arm, peel it off. Just drag that top layer down and then use the donning gloves to pinch some more and keep moving that off.
Yeah, for my patients, I've used a piece of Dyson on the floor too, so that they fold it down, like you said, they get it down to the bottom, but also start to get that heel off, because that heel is some of the hardest parts. And sometimes too, maybe you combining that with the Butler Off, just in case they don't have the flexibility, at their hips or anything like that they can use that. Great.
Yeah, that's a great idea.
Can you talk a little bit more about specific donning aids for the arm?
Yes. So again, my favorite is that Easy Slide. That you can hear, it's kind of like a parachute material. You can hear it rubbing the friction against the inside. So the one for the arm comes up higher, and that's beyond my favorite. And I love the loop at the ends, because you can, especially with custom ones, you can just attach it to a doorknob and it'll pull right out. There is a company that makes stockades that also makes a smaller one that fits just around the wrist. So that would be a great one to use for sleeves too.
Great. Do you recommend using a plastic store bag tied and then cut and pulled after donning?
I have seen that used. The plastic bags aren't very durable, so if you don't mind putting in, a couple dollars, those sock slippies are great and they are very durable. They're well worth the investment, but I do know some of the nursing aides here use the plastic bags. Here in New York, we've gotten rid of plastic bags, so you have a harder time finding them and replacing them. But yeah, whatever works.
Yeah, I've had the plastic like grocery bags don't ever really work, at least in my experience. But some of those like thicker plastic bags that you might get that are reusable, I've had patients, use that, and that seems to be better. But the problem is that when you go to pull it out, a grocery bag, will rip easily, and now you still have your garment on, and now you have bag stuck into your garment as well. Yeah, yeah. Do you have any advice or devices for thigh-high garment donning?
For thigh high, yeah, the videos that I made were all knee high stockings. But I know a lot of those garments will work for thigh high as well.
Welcome back. I hope you are all enjoying the second morning of this fabulous symposium. We've done some breathing, we've done some upper body exercises, and today I want to focus on moving your legs. And this is something that we will do together now and that you can do throughout the remainder of the symposium while again you're in your chair and you're watching all of the amazing presentations. So start by sitting up nice and tall, shoulders pulled back and feet flat on the floor. And we're slowly going to first raise our toes and then our heels. So toes up, down, heels up, down. And let's do 10 of these. This is going to be 2. Go at your own pace, go through your own comfortable range of motion. The goal is to get some movement, to get the muscles active, and to get the blood and lymph flowing. And this is number 5. We're halfway there. 6, 7, 8, 9, and 10. And now we're just going to extend one leg out, tap the heel and back, and the opposite leg. And this is number 2. As you sit up tall, maintain good posture. Go at your own comfortable pace. This is 3. We're going to go to 5, 4, and 5. So we're going to now take the leg, tap the foot forward, keep the knees straight, pull the belly button in, sit really tall, and gently lean forward with our back straight, and you're going to feel a great stretch in your hamstring and maybe all the way down to your calf muscle. Just gently lean onto your other leg for support while you feel this great stretch down the entirety of your leg. You can pull your foot up like mine if you want the stretch to be more aggressive, but if that's too much, just keep the foot in a relaxed position. We will stay here for a total of about 10 to 15 seconds, so we're probably getting close to being done. And we're going to switch sides. Bring the foot back, switch sides. My toe is pulled up, my knee is straight. I'm sitting nice and tall, and I'm just going to gently lean forward from the hip. And you can see because I am so tight, I don't get a lot of motion. If you're a little bit more flexible than me, you might be able to lean forward a little bit more. The goal is to feel the stretch in a comfortable manner that you can maintain. If this hurts, I absolutely don't want you to lean forward so much. Stay within your own comfort zone. Take some nice, slow, deep breaths. And we're going to do one more on each side. Knee straight, toe pulled up, back straight, leaning forward. And we're going to hold here for about 15 seconds. So another few slow, deep breaths. switch legs. Same thing last time. Feel that nice stretch on the back of your thigh and calf area. And know that you're doing good for your body in the middle of sitting at your computer and watching all of these excellent lectures. Okay, last thing, I want you to stand up. And we are going to do a chair pose. And this is a very common pose in yoga. And it's meant to get a good stretch in your spine. I want you to hold on to a chair if you need, or if you're an established yogi and you don't need the chair, great. You're going to spread your feet about shoulder width apart. And what you're going to do is mimic sitting in a chair, so your body should look like a chair. You want to keep a nice, straight spine. Only sit as low as you can comfortably, holding on. Your rear end is going to stretch backwards, and now what you're going to do is look straight ahead and stretch your arm or arms up in front of you. So from my rear end to the tips of my fingers, I should be making a straight line, pushing up and sitting back, stretching and breathing, and stand up. We're going to do 2 more of those. Get a nice full body stretch and workout in this quick 5-minute break. And again, chair pose. Sit back, reach up, get a great stretch in that spine. You've got this. Don't forget to breathe. Hold on if you need to. And stand up. And last one for the morning. Sit back, pull your belly button in if you're having a hard time keeping your spine straight. Reach up and stretch up and stretch down. Feel that nice elongation in your spine. Keep breathing. Feel the blood flowing and the muscles working. And great job. You now have the blood flowing to pay attention for the last little bit of this patient symposium and all of the presentations. I hope you're feeling good, and I can't wait to see you one more time in just a little bit.
Hello, everyone, and thank you, Jen, for the lovely introduction. I just want to say that most of my lymphedema career has been spent in cancer centers, and hence I apologize ahead of time if I talk a little bit more, if I address a little bit more the people with who are cancer survivors, but I'll try to address everyone. So the objectives, I'll just read them real fast. Understand the role of compression pumps in lymphedema treatment, understand the type of pumps, and understand how to apply compression pumps. Right. So a little bit of background that you probably heard some of it in other lectures. Lymphedema can be primary, i.e. inherited, or secondary, as a common result of cancer or cancer treatment, venous disease, etc. And here's the little cancer angle, because that is where I work as on my career. Cancer survivorship has improved substantially over the recent decades. As survivorship improves, we have more survivors. So we do see more of the side effects of treatment, including lymphedema. So we do see some increase in lymphedema. More than 10 million Americans suffer from lymphedema. That's very large number, a lot more than Parkinson's and MS and some other diseases you hear about. Management of lymphedema requires lifetime burdensome self-care, and compression devices are a convenient self-management option, and hence we decided to bring this subject up in this symposium. Okay, a little bit of history. Bandages were used in ancient cultures for the treatment of wounds and swelling. Okay, next. The knowledge evolved over the years to many forms of different type of bandages, and we had the lecture before and about different kind of compression, and so we see different kind of bandages. We see elastic, inelastic, we see Velcro, we see quilted ones for knives, etc. Since the 19th century, pneumatic compression pumps is being developed and improved. We see a picture here in the middle of Germany, a pump in Germany in 1912, even earlier one from France in 1834. In the beginning, at the very beginning, well, not quite the beginning like the picture, but in the beginning of pneumatic compression pumps. So first, it started with single chamber pumps. I'll explain what it is in a couple of minutes. And professional lymphedema therapies has not even been developed yet. Compression garments were limited at the beginning to stockings. Other kind of garments we showed before were not available. Okay, in the 1970s, Professor Zelikovsky and Mego Afek developed the first multi-chamber gradient device in garments with overlapping chambers for treatment of lymphedema. One of the products is mentioned here, but we are not promoting any products, so I just wanted to show it. The first multi-chamber pump, the first field tests were held in 1978 in the US and Europe. And they showed positive results. Here's a picture of a 16-year-old boy with before use of the pump and after 10 days of using the pump. And then the concept was approved for home care, first in the US and later in other countries, together with other modalities. Okay. In the next section, we talk a little bit about the effectiveness per the literature. Generally, when you elect to use a medical device or medication, that is, you want to know that it's effective and it's not harmful. So I wanted to show a few articles about the effectiveness what is the literature telling us about these devices, whether they're effective or not. And bear with me, this is a bit tedious, the next part, but I'll try to go through it fast. I'm going to bring a few articles, a few researches to show you. All right, 2020 study in Chicago took 128 patients, gave them pneumatic compression pumps for 3 years, and it found, by the way, pneumatic means air. So it's pumps that use air to compress the limb, to compress the swollen area of our body. So it followed these patients for 3 years, and it found that the pump improved outcomes. It improved functional status, it reduced the lymphedema related complications. But surprisingly, something they did not expect is that it also reduced BMI. And the question is, why would you lose weight or reduce BMI after using the compression pump? We don't really know, but the writers or the authors of this study hypothesized that because people were more active, their lymphedema reduced, they were able to be more active, they also lost weight. This is like an unintended positive consequence of using a pump. 2023 study, next one in Germany, looked at 3 groups of people with leg edema. One of them had 4 weeks use of the pump and MLD. MLD is a massage we do for lymphedema. Second one had just MLD. The third one had the pump alone to see which one is more effective. And really, there was no big differences between them, except that the 2 groups that used the pump reported better quality of life, perhaps because it is easier and more convenient. Okay, next one, 2022 study at UPMC. We just saw a presentation from UPMC, I think. Followed 2 groups of patients over 18 months. The people had leg edema. Group number 1 received a standard treatment for lower extremity lymphedema, and group number 2 received the standard treatment and the pump. And the question is, which one was better? So both groups showed improvement, and this is listed below is some of the improvement of group number 2, but the main difference was that sorry, we gotta go back. Forward, sorry about that. The main difference was that group number 2, in other words, the group that had the pump and the traditional treatment, they saw a lot more compliance with the pump versus just MLD, just the massage. Okay. And now one more study about a specific type of lymphedema called lipedema. It's a form of swelling affecting 11% of the population, primarily women, and primarily triggered around hormonal changes. So 2021 study had 33 women in a study with severe lipedema and divided them into 3 groups. Group number 1 had the traditional lymphatic treatment, the CDT, complete decongestive treatment, and exercise. Group number 2 had pump and exercise. Group number 3 had exercise alone. And what they found is that all 3 groups improved. So that supported the hypothesis that exercise at a moderate intensity is very beneficial for this type of lymphedema. And group number 1 has a slightly better improvement. So this study did not show that the pump was in it by itself was more effective for this group. And I think we're down to almost the last one. Okay, 2022 study in the UK found that when they gave people with leg edema, compression pump, lymphedema volume decreased. And then once you took the pump away, that there was a rebound effect. So the swelling increased again. And the same thing happened with quality of life. When you removed the pump, it worsened. When you removed, it was better with the pump. When you removed the pump, there was a worsening. Okay, next. I think this is our last, bear with me, last one. 2022 commentary study talked about the economic, I thought it was interesting to look at that because it's something people don't discuss normally, the economic cost of lymphedema. So they included direct costs, somewhere between $2,500 to $3,200 a year of direct healthcare costs, garments and other things that include direct healthcare costs, and indirect costs between $2,600 and $5,500 includes lost wages, decreased work performance. So in general, we know that lymphedema is, for the most part, chronic. We have to take care of it ongoing throughout our life. And generally, chronic illnesses, the adherence to the plan of care decreases over time. So as such, we expect that the cost will go up as we decrease adherence. And the article suggests that compression, this time they talked about a non-pneumatic compression device. Nevertheless, compression device may increase adherence to the treatment. Okay, good. We did it. The bottom line is, though, what, in terms of what the research shows us, is that most studies demonstrated that the pumps help with ability to care for your lymphedema, as well as with quality of life. Okay, so now we're going to move on to talk about types of pumps. I'm going to present 4 types of pumps: 3 pneumatic compression pumps and 1 non-pneumatic compression. So the first one is called a single chamber pneumatic compression. And I just want to give an example of what it's like. I may be dating myself here, but you know those flotation arm, these arm flotation devices that you put on kids in a pool, and you blow air in them, and it helps the kids float in the pool. So this is very similar to that. You basically, or even you can liken it to a beach ball that you put it on the arm, you blow air in it, it just pumps the whole, it just compresses the whole arm. But this is what happens with this. It's almost like a toothpaste tube that if you just compress it, the fluid, where is the fluid going to go? It can go either to the hand or to the upper arm. It can go either to the ankle, the feet, the groin. So it really is, for that reason, single chamber sleeve or compression pump is no longer recommended. So if you have one in your closet, if you have one at home, and after this presentation you say, I gotta go use my compression pump, please do discard it. And actually, it'd be good if you also don't contribute it. We don't want other people to use it. These kind of devices are no longer recommended. Okay, sequential pump is the next one, sometimes referred to as a basic pump. This pump is a single pressure control that inflates and deflates various air chambers in the garments sequentially, so not all at once. Basic pumps are a little less expensive than the advanced pumps, and some insurers require a trial with these pumps first to see if they're successful before they approve the most advanced pump, the Cadillac. I know I'm not supposed to promote any name brand, but the Cadillac. So here is a Cadillac. It's called advanced pump. It is a calibrating grading compression, which means that there's the ability to set different pressure in at least 3 different places in the garment. So it allows adjusting the pressure and gives special consideration to areas of pain or to areas that require more compression. And the other basic, really big difference about this pump is that they apply treatment to the torso as well. So if you look at the picture on top, you see the woman presumably has swelling in her legs, but the pump goes all the way up to cover the torso. So which one is best? So a 2022 study in the UK took 40 people with leg edema. It divided them to 2 groups. Group number 1 got the basic pump with a graduated sequential pump, and group number 2, group B, got advanced pump. And drum roll, the results were mixed. Both groups had improved lymphedema volume. Both groups had improved quality of life. Once the pump removed, both groups experienced rebound. We talked about the rebound effect before. So in other words, once you remove the pump, both the lymph volume, you have more swelling and you have decreased quality of life. There was no difference in quality of life between the 2 groups, but the advanced pump was significantly better at reducing leg volume or reducing the swelling than the sequential one. So advanced one is preferred. So here's another type of non-pneumatic active compression. So in other words, there's no air involved. There's no air being blown and compresses. I'm not sure if hybrid is the right way to call it, but it's a sort of a mix between, it's a non-air pump, it's also not passive compression. So in other words, it's not socks or compression sleeves, etc. So it does not work by inflating air. It has embedded spring-like segments that contract and relax to provide compression. It's mobile, it's low profile, it's light. You can see the man in the picture walking his dog, wearing it and having a control sort of hanging over his shoulder there. 2023 study of lymphatic research in biology recruited 40 women with lymphedema in the San Francisco Bay Area, and it found improved quality of life, improved adherence, and lymph volume also improved with these types of pumps. Okay. So now, how do we use the pumps? All types of pumps that I listed above, except the first one. Remember, we do not want to use the first one. So most manufacturers recommend using the pumps 2 times per day, 7 days a week, each time 45 to 60 minutes per session. The literature supports 1 time a day. So here's a study that divided participants into 3 groups. Group number 1, use a pump for 1 hour once a day. Group number 2, 1 hour twice a day. Group number 3, 2 hours twice a day. All I have to say about that is, ouch. That is a lot of time. That is a part-time job. And it found no clear differences between the 3 groups. I don't know about you, but if it were me, if it was up to me, I'd rather use it just 1 time a day. Put the pump on, put on my favorite Netflix show, and let the pump do its job. I'd rather not add a job to my day. How about the setting? Most pumps can be set at 20 to 60 millimeter mercury of pressure, and it depends on many factors such as types of lymphedema, venous, cancer, etc., location of edema, stage of lymphedema, quality of the skin is how much compression you put it on. But just so you know, compression can be changed. So you usually want to do it together with your therapies and or your pump representative. So if you feel it's too tight, it can be made looser, or too loose, it can be changed. Or in the pumps, the setting can be changed. All right, what to wear? Most manufacturers suggest wearing light single layer clothes, preferably cotton, other fabric that can absorb perspiration. Some of the people come to me, some of my patients ask me, can I wear my compression sleeve underneath the pump? So the question is, it depends. Elastic compression garments are not recommended because they can bunch up under the pump and can cause irritation. It can also cause some tourniquet effect. Okay, inelastic garments can be worn safely under the pump, but will alter the carefully calibrated compression applied by the pump. And sometimes we recommend using fibrosis pads to address specific area of fibrosis. And the end. Thank you so much for taking the time your Sunday to listen to me. Greatly appreciated. And any questions? If we have time, we can answer. If not, you can send them. Jen was going to leave my email, both my work and home email, and I'm happy to get back to you.
Yes, I definitely will add those in the chat, absolutely. We just have a couple questions we're going to answer. I know there's quite a bit, and like Dalit said, please, email NLN@lymphnet, or I will put her email in there and you can email her directly. So one of the questions is, do you need to do manual lymph drainage on the leg along with compression pumps? And if so, which one do you do first?
So the pumps, the idea and why we see an improvement in quality of life is the pump's supposed to mimic MLD, it's supposed to mimic manual lymphatic drainage, and so you can use it instead. The idea is to first do your therapy with your therapies, your MLD, and the other things that we use at the clinic. And once you're ready for home use, for home, we are giving you a tool to just make life easier for you, to increase your quality of life, and just use a pump. That's why I mentioned watching Netflix while using the pump.
Yep, reading your favorite book, reading the news.
Absolutely, book, of course.
If excuse me, if the skin is not intact, can the pump be used?
So that is on a case by case. It has to be looked at on a case by case situation. You have to discuss it with your wound care doctor. You can discuss it with your therapist. I'm probably not the most qualified person to discuss it because, as I said, I work mostly with cancer patients, and I do not work with the people with wounds quite as much. So I can get back to you. If you send it to me on an email, I will get back to you with that answer.
Great. How often should the pressures be checked and changed on the pump?
I think that once we set a pressure that you're comfortable with and you can tolerate, it does not really need to be changed. Sort of like we do with garments. We change the garments because the elasticity change and they wear out, but we don't necessarily have to change the amount of compression.
What are the precautions and contraindications for the pump?
So the precautions are the same precautions, the contraindication that we use for MLD. So if you have a cellulitis, if you have an active infection, you should wait until a few days of using antibiotics. If you have a blood clot, an acute clotting, then you need to discuss with your doctor. You need to be on anticoagulation first before you resume the pump.
Thank you and the NLN for inviting me to make this presentation. So whenever you're ready, you're going to share my slides. Okay, great. So I'd like to welcome everyone to learn about the Lymphedema Treatment Act. I understand that living with lymphedema isn't easy. It's a journey filled with challenges, both physical and emotional. But today we're here to talk about something that brings a ray of hope and a path towards better management of this condition. It's the Lymphedema Treatment Act. So over the next few slides, we'll discuss what the Lymphedema Treatment Act covers, how you can take full advantage of your insurance benefits, and the steps you need to take to ensure you're getting the tools and care you need. So let's get started. There's a lot of information, and it's not always cut and dry, but I'm going to give it a try. What we're going to discuss is who's eligible, what is covered, how often garments will be allowed, and where to find your necessary supplies. But those of you who have not heard about the LTA or unaware of what it means for you, the passage of the Lymphedema Treatment Act represents a significant step forward in addressing the needs of individuals with lymphedema, reducing their financial burden and allowing their overall health outcomes. So, what is the LTA? It's the Lymphedema Treatment Act. It's a federal law aimed at improving insurance coverage for the treatment of lymphedema by the Centers of Medicare and Medicaid Services, or simply the CMS. It ensures that Medicare covers compression garments, bandages, and other necessary supplies to manage it. There are two types of Medicare. There's traditional and Medicare Advantage. Traditional Medicare coverage is comprised of Part A, hospitalization, and Part B, outpatient. So when we look at the LTA, it's under the annual Part B. It will pay 80%, which leaves a copay of 20% for the patient. If you have a supplemental insurance, they may pick up the remaining portion. Otherwise, the 20% becomes the patient responsibility. Then there's Medicare Advantage plans, known as Part C. They are run by private health plans that are approved by Medicare and offer an alternative to the original Medicare. But Medicare Advantage and other private insurance payments will vary based on the policy terms for the DMEPOS supply section of the policy. So most private insurances will follow Medicare's guidelines. And by the way, there are a lot of acronyms thrown around. So what DMEPOS stands for is durable medical equipment, prosthetics, orthotics, and supplies. So it's important to know that the LTA faces complex situation as it navigates through its first year. It's definitely not a finished law. This year will provide feedback to make adjustments and improve the care for lymphatic patients. There have been procedures in place for making annual adjustments in the future. So who is eligible? So anyone who has a lymphedema diagnosis from your doctor. A doctor will provide the correct diagnostic code to get the coverage and the prescription for the garments and supplies. So to reiterate, a diagnosis and a prescription are necessary for coverage. It doesn't matter why you have lymphedema. It can be the secondary because of another issue, or primary because you have a genetic or hereditary cause. Even if you have lymphedema, as long as there's a lymphedema diagnosis, you will be covered. So CMS has listed the following diagnostic codes in the final rule. Lymphedema not elsewhere classified, 189.0. Hereditary lymphedema, Q82.0. Post-mastectomy lymphedema syndrome, 197.2. And other post-procedural complications and disorders of the circulatory system not elsewhere classified, 19789. So how do you access the benefits? Well, obtain the prescription from your doctor and the diagnosis, submit the necessary documentation for your insurance company, and follow up to ensure the processing. So here's some tips. Keep detailed records of all your communications. Hugely, hugely necessary. Be clear and concise when explaining your needs, and know your policy and appeals decision if necessary. So the LTA is monitoring the denials. So if you've been denied, I want you to go to the LTA website and please submit the information on their website under Denial Reporting Form page. They use this information to address the problems incurred and help with the future adjustments. So this is where having CDT and a CLT as your advocate. And here's where my profession excels. Though it's not a requirement to see a CLT to have a garment covered, a CLT can play a crucial role in helping you obtain compression garments through the Lymphedema Treatment Act. Not only can they make the appropriate reduction of your girth, educate you for best practices and risk reduction, they will provide guidance to picking the best suited garment and work with you to learn how to put it on and take it off. A medical assessment is conducted and a thorough evaluation to determine the appropriate type and level of the compression needed, and prepare and supply detailed medical documentation supporting the necessity of the compression garments and in providing assistance for your insurance paperwork, ensuring all the required information is included to meet the criteria under the LTA. So after the garment is created, they will check to make sure that the compression garment fits correctly, which is crucial for that effectiveness. Train and educate you on how to properly wear and care for the compression garments. And always, we advocate on your behalf with insurance companies to ensure you receive benefits entitled under the LTA. Providing follow-up care to monitor the effectiveness of the compression garment and make adjustments if needed. And we also offer resources and support groups for additional assistance and information. So to summarize, the practical steps: get that appointment with your CLT to discuss your needs for the compression garment. Gather your information of your insurance and any prior medical records to the consultation. Follow your CLT's guidance. Work with your CLT to submit the claims to your insurance company and appeal if necessary. If the coverage is denied, your CLT may be able to help navigate the appeals process. By working closely with the certified lymphedema therapist, you can maximize your chances of successfully obtaining compression garments through the provisions of the Lymphedema Treatment Act. Okay, so what insurance coverage allows: custom and ready-made daytime and nighttime compression garments, gradient compression wraps, and adjustable straps, bandaging supplies for any phase of treatment, accessories including but not limited to donning and doffing aids, padding, fillers, linings, and zippers. You should be able to pick your preferred garment through the DMU supply. But I want to make a note that unfortunately, compression pumps do not fall into the LTA's coverage. They have been assigned under CMS's DME category, and the LTA does not affect their coverage. patients have to qualify to get them. To be eligible for a compression pump, the patient must qualify by these standards: the patient's prognosis and diagnosis, symptoms and objective findings, including measurements which establish the severity of the condition, the reason the device is required, including the treatments which have been tried and failed, and the clinical response to the initial treatment with the device. Also, it's important to know that there's a criteria to meet for a custom fit versus a standard garment. There must be documentation in your medical records stating that a custom garment is required to address your specific needs. Examples would be unusual contours that would not fit into a standard garment. If the skin tissues have folds or contours requiring a specific type of knitting pattern, or the beneficiary is unable to tolerate the fabric composition of the standard. And these are just some examples. Garment supply schedule. Well, this is looking pretty good. Daytime garments, you get 3 sets every 6 months, standard or custom fit or a combination of both. So let's talk. Okay, 1 garment for each affected body part. Look at your leg. You have a calf, you have a thigh. Each one of those is a body part. So you would have 3 sets for the calf, 3 sets for the thigh. Nighttime garments, 2 sets every 2 years, standard or custom fit or a combination of both. Bandaging supplies, no set limit in the rule. Accessories, no set limit, will be determined on a case-by-case basis depending on the needs of the patient. So Medicare will replace your garments sooner if your garments are either lost, stolen, or damaged beyond repair, or if your affected area has changed in size. But under any private insurance policy, there may be a need for an appeal process to seek the approval. Finding your necessary supplies, it can be a challenge, but first, speak with your CLT. They may work with the DME POS, or their facility may have gone through the process to become a DME POS. Otherwise, consider asking your doctor or therapist if they have a list of trusted suppliers. Contact your insurance company. They may only work with certain businesses as an in-network plan. There is the Medicare Supplier Directory to find DME suppliers approved by Medicare. When looking on this site, make sure that you write in the search lymphedema compression supplies. The LTA website has names listed under lymphedema compression suppliers page. Search online businesses by asking where to find compression garments for lymphedema. Many online retailers offer compression garments, but you need to ensure they are of medical grade. Search for medical supply stores or local pharmacy in your area that may carry compression garments or could order them for you. Manufacturer websites that specialize in compression garments, there may be a list of authorized retailers. Call the customer service of manufacturers for recommendations. Online communities are a great resource. You can join online forums and support groups where members share recommendations for DME suppliers, or you can look for local support groups for a personal recommendation. Ensure that the DME suppliers are accredited by organizations like the Joint Commissions or the ACHC, which is Accreditation Commission for Healthcare. Look for the reviews and the ratings from other customers to gauge the quality of the service of the supplier. Only an enrolled DME POS supplier to Medicare will be able to bill for Medicare. So key tips here: insurance coverage, verify if the supplier accepts your insurance. Fitting services, if you're not using the CLT, ensure the supplier offers fitting services to get the correct size. Return policy, highlight this one. Check the return policy in case the garments do not fit properly. By following these steps, you should be able to find a reliable DME supplier for purchasing compression garments. patient rights and advocacy. You need to understand your rights under the Lymphedema Treatment Act. Advocate for yourself by staying informed. Join those support groups and advocacy organizations. So I've given you a list here of different resources. This is not all. This is just a portion, but honestly, I don't think I have a page long enough to fit all of them in. But lymphedematreatmentact.org, what I have not covered, what I have not been able to provide for you today, you're going to find it there on that website. There are so many great opportunities to understand what's going on. And of course, us here at the National Lymphedema Network, we have every concern for you. We are here for you, and we want to help take care of you. Lymphatic Education Research Network, Lymphology Association of North America, Lymphedema Simplified, Lymphedema Foundation, International Lymphedema Foundation, International Lymphedema Framework, Lymphy Strong Support Group. They're all there to try to help. So, but I'm going to suggest help support the LTA and stay in the know. Subscribe to their newsletter by going to the lymphedematreatmentact.org. And honestly, we owe a world of thanks to Heather Ferguson. She's the founder and executive director of the LTA, and her state teams and volunteers for their endless work over the course of 12 years to bring this bill to fruition. I want to thank you so much for letting me be a part of this amazing group.
Welcome back for the last time. I hope you have enjoyed the symposium and learning some brief exercises and stretches that you can do even when you're sitting at your computer. For our last break, we're going to start with some modified rebounding exercises. Rebounding is something that is so great to do in patients with lymphedema and with any limited mobility to get all of the fluid flowing in our body, lymphatic fluid and blood circulation as well. There's not much research that proves it's doing as much movement as we think it might be doing, but we know by controlling a gentle bounce, we're using all of the muscles in our body to keep us upright and to balance. And that is all that we're looking for right now, is to get some movement and work done in our body. So we're gonna stand up again. We're gonna hold on to our chair, and we're gonna do a gentle bounce. So whether you wanna hold on with two hands and just up and down, as high as you can go comfortably, we're getting the blood flowing. I don't want you to focus on counting. I want you to focus on moving safely, moving in whatever position is comfortable for you, as much or as little as you like, and feel those calves starting to burn. Feel the fluid moving throughout your whole body. You can make it bigger. You can actually jump and get your feet off the floor if you'd like. In hopes of not losing my breath terribly, I'm going to stay with a light, low bounce. We can shake the hands, we can wiggle the hips, whatever you want to do. Get all that blood and lymph flowing. And now that we've got everything moving, we're going to do one last breathing technique all together to help calm us back down. This type of breathing technique is called the 4-7-8 breathing technique. It helps promote focus, so you can focus on these last few presentations. It also helps promote relaxation and sleep, which I want you to do after the symposium is over. So, back in your chair, preferably nice, tall, but relaxed posture. Both feet on the floor. I'm going to sit back a little bit to make myself comfortable. And what you're going to do is you're going to focus on breathing in for 4 seconds. After you breathe in for 4, you are going to hold your breath for 7 seconds. And then lastly, you are going to exhale for 8 seconds. So this is called the 4-7-8 breathing technique. Now, as our body starts to relax and come down from our little bouncing session, I want you to first just sit and take some nice relaxing breaths at your own pace to make sure that your breathing has normalized. And for some people, a 4, 7, 8 breath might be challenging. So the goal is to build up to that and understand that this breathing technique is doing all of the things I mentioned: focus, relaxation, promoting sleep. So perhaps tonight when you're going to bed and you're thinking about all the wonderful information you've been taking in, maybe that's a better time to start practicing this technique. So you are going to start by breathing in for a count of 4. Breathe in through the nose. Now hold for a count of 7. And slowly exhale for a count of 8. As you exhale, I want you to try and focus on exhaling from your mouth or from your throat, with your mouth in a relaxed position. So no pursed lips, just relaxed breath. And we're going to repeat this breathing technique. Breathe in through your nose for a count of 4. Hold for 7. And now exhale for 8, nice and slow from the mouth. Again, breathe in for 4. Hold for 7. And exhale for 8. Thank you so much for joining me on these stretching and breathing breaks. I hope they have been helpful and have helped you get through this symposium feeling good and taking it all in. I wish you the best. I hope you get the most out of the remainder of the symposium, and I will look forward to seeing you next time.
Okay, excellent. So I want to introduce our next speaker, Cyndi Wessels. Cyndi is a contracts manager for a government contractor and has been living with left leg lymphedema since 1990. Cyndi received the diagnosis in 1993 and traveled to Pennsylvania shortly after being diagnosed and began using the right linear pump. She did not receive complete decongestive therapy until 1998. Currently, she has been independently managing her symptoms with a reed sleeve and compression garment. Cyndi recently began volunteering for the NLN and will be a part of the patient committee beginning later this year. She enjoys reading, spending time with her dogs, and wine tasting with friends. Thank you so much for being here today, Cyndi. Welcome.
Thank you, Jen. I appreciate it. And I just wanted to say thank you to you and the entire NLN with all the presenters you've had. This has been a wonderful symposium over the last few days. Unfortunately, I can't get my camera to work, so I apologize for that. I don't have any presentation to share with you or any videos to share with you. So it's just going to be me talking, and the fact that my video won't work, that's probably a blessing for everybody on here. As Jen mentioned, I was diagnosed with lymphedema in 1993. I actually have lymphedema and lipedema, and the symptoms kind of onset in my late 20s. And I started out with the right linear pump after visiting Sewickley, Pennsylvania. I think it's called Encompass Health now. With that pump, I was required to use it 8 hours a day. And it was a very large, bulky pump. It was in a black carrying case that weighed about 15 pounds. Over the use of it, which I could never use it for a full 8 hours a day because it was uncomfortable and painful, I ended up developing a fibrotic tissue on the back of my leg right underneath my knee. So I stopped using it for the most part. And then I started with the manual lymph drainage. I found a therapist in Maryland. I live in Virginia. I found a therapist there, and I was seeing her 5 days a week for the manual lymph drainage and the compression bandaging. That slowly reduced to 3 days a week, and I went there for about 2 to 3 years. I probably would have continued with her, but she moved to Florida. So I said, okay, I can do this on my own. You know, I had been dealing with it for 5 years at this point, or more than 5 years. And I knew how to do the self massage. I knew how to wrap my leg correctly so that I wasn't cutting off my circulation. So I started doing my self management. And in about 2014, I went back to Georgetown Hospital, which is where I originally received the diagnosis. I had gone there in 93 because of the pain I was having in my ankle. And through all of this, my ankle ended up fusing from arthritis, but that's a different story. But I had gone back to the doctor I saw in 1993, and I showed him the incredible results I had achieved through the MLD and through the compression. And I talked to him about the all the loose skin that I had. And it was agreed that I would have surgery to excise the loose skin to help bring down the leg even more. Now, what I need to tell you is when I started this, my left leg, which is the lymphedema leg, was 300% larger than my right leg. Huge, huge difference. Mobility was a massive issue for me. Luckily, I was on the younger side at that point. But by the time I had gone to see him again in 2014, my left leg was about 87% larger than my right leg. So a huge decrease. So I had the surgery. And after that surgery, with the removal of skin, I probably lost I think they said between 5 and 8 pounds just of excess skin. And I was able to get into a custom compression garment. I wear the full like pantyhose, but just on the left leg, and I have like it's a slight compression on the right thigh, and that's been working wonderfully for me. I don't use the compression bandaging anymore. At night I use the reed sleeve, which is the most wonderful invention I could even possibly think of. It provides the compression that I need. It is completely comfortable. I can sleep in it, and it's very portable. So if I go on vacation, I just put it in the bag. It looks like I'm going skiing, but it's super light, very comfortable, and yeah, it's changed my life. And I have to say that, you know, in talking with Jen and seeing all the literature out there and all the information that's out there, it has grown exponentially since my first diagnosis in 93. I'm just so happy to see how far it's come, because at that point in 93, I thought I was the only one. And I'm so happy that there's so much support out there for this now. And it's just, it makes me very happy. And anything that I can do or to help people, I want to do that. I want to give back, because I know it's a difficult journey, but it is one that does get better. But if I can tell you anything, the number one thing you can do to help you through your journey is compliance. Be a compliant patient. Listen to your therapist. Do the work. Take care of your skin. It gets frustrating. I can't tell you how many times I threw bandages across a room because I was having a hard time. But you have to stick with it and just be compliant. You'll see the results, and it'll just make a difference in your journey for sure. So Jen, that's pretty much all I had. So if anybody has questions for me, I'm happy to answer them.
Thank you so much, Cyndi, for sharing your story. It really is important. I think, you know, we're all therapists here, and You know, we obviously work with patients every day, with these types of things. And so, you know, hearing from someone who has been through it and is living with it is so important. I have a question for you. Do you have to go back and see your therapist, or do you have a regular routine that you see your therapist intermittently to follow up, or just as a assessment?
You know what? I don't. Well, I shouldn't say that. I did go see a therapist, but only to get a new reed sleeve for my nighttime wear. I haven't been assessed in quite some time. In fact, the compression garment that I wear is the same size that I've been wearing for the last what is 7, 4, 5, I guess 8 years, 8 to 10 years. So it's been maintained. Now, if I do come across a problem or if I'm having an issue, I will definitely go back and see her. But I'm a very independent person, so I like to make sure that I'm doing whatever I can do. And I mean, I'm not telling people not to go see a therapist, because you absolutely should, unless you're at a point where you are managing it and you are happy and you are healthy. But yeah, I will go for measurements or new garments, but that's about it. Yeah.
Excellent. And could you explain to people what a reed sleeve is?
Sure. So it looks like a big, well, it's a boot. It's soft material, and on the inside, it looks like almost like that eggshell carton material that some people have on their bed. And when you get it initially, you have to take it to your therapist, and there's a pump that comes with it, and it blows the sleeve up to the right compression amount, and then it's just basically you slip it on. And this, I only know this for the legs, so my apologies, but you slip it on. Mine goes all the way up to the top of the thigh. It gets zipped up, and then you Velcro it on. Yes, that's pretty much what it looks like there. And it's super comfortable. I can sleep on either side. I can sleep on my back. It doesn't bother me. And it's wonderful. And you're not tethered to anything. So that's another big thing for me. And you're mobile. You shouldn't walk on it. And the only time I do walk on it is because I have to get up in the middle of the night to use the restroom. So, but that's it.
Yeah, and again, you know, if you're looking at this particular device that Cyndi is using, please speak with your therapist first about, you know, if this is appropriate, because what works for Cyndi may not work for someone else. So thank you so much, Cyndi, for being here today and sharing your story. Really appreciate it. We're so excited that Cyndi is going to be part of our patient committee. If you are interested in being part of the patient committee, you can apply at our website at lymphnet.org. We are looking for people to help us with new programming and really making sure that all of our education is pertinent to those living with lymphedema. And really, it's so important, like I said before, to get the person who's living with this disease to give their input and work together with therapists. So thank you again, Cyndi, so much.
And thank you. Appreciate it.
Okay, our next speaker is Amy Rivera. She is a resilient advocate, inspirational speaker, and author dedicated to empowering individuals living with lymphedema and other chronic conditions. As the founder of Ninjas Fighting Lymphedema Foundation and Rivera Hybrid Solutions, she has made it her mission to provide support and resources to those in need. Through her compelling journey, she has become a prominent voice in the lymphedema community, sharing her experiences and insights to raise awareness and foster a sense of community. Amy's expertise extends beyond advocacy work. She has developed innovative resources equipping individuals with knowledge and tools to manage their condition effectively. Her background in healthcare further enhances her ability to provide valuable guidance and support. She is also the author of the award-winning memoir, Drop the Skirt: How My Disability Became My Superpower. Her book serves as a source of inspiration for individuals navigating through their own challenges, offering practical insights and heartfelt encouragement. Through her work, Amy continues to be a beacon of hope and positivity, reshaping the narrative around chronic conditions. With her unwavering commitment to making a difference, she empowers individuals to thrive and live fulfilling lives despite their circumstances. Thank you so much, Amy, for being here today.
So thank you for the introduction. And I have to say to Cyndi before we start, I resonated with so much of your story and felt alone. So thank you for being so brave and sharing your journey with us. That's what everything's about, right? So today we're going to talk about unlocking the flow, innovative approaches to move lymphatic fluid, especially in the central lymphatic dysfunction area. We often hear about all these amazing products and treatments, but sometimes they may not work for us. So I focus primarily on what will work for us. So there's no objectives. So real quick, a little bit about who I am regarding my lymphedema. I was born with primary lymphedema in 1981, actually, and it affected the entire right side of my body. My parents said that I looked like two different infants. My right side was twice the size of my left side, so we knew something was going on, but we didn't know what. In this picture, guys, I tried really hard to find some images, but ironically, my family started to hide my lymphedema as an infant, so I didn't have very many images without a cover or a blanket covering the right side of my body. This was one of the few that I could find. As I continued to grow, my right leg continued to grow. So when I was 3 days old, everything went down on the right side of my body except for my right leg. So my parents took me to every physician you could think of, and they didn't know what it was. They just said it was abnormal swelling, and there was nothing they could really do about it at that time. So as you see, it just started out very minimal, but it still affected my right leg to the point where it was hard to wear shoes, trousers, or any type of socks. So a lot of times I wore dresses and stretchy socks. As I continued to grow, so did my right leg. And unfortunately, I remained undiagnosed for over 3 decades. Turning my right leg grew to be double the size of my left leg. It was 200% larger and an extra 35 pounds. So it wasn't until 2013, which was 32 years later, that I received an official diagnosis of primary lymphedema. So one of the things that kept my mental health in a positive direction was being active, even with a limb that size. So I knew being active was just a way of managing my lymphedema, but it also managed my mental health. And actually, many doctors and physical therapists, they told me not to work out with my leg being this large. At that time, they didn't know it was lymphedema, nor did they know what was going on, but they said it would exasperate whatever the swelling was being caused from. Now, in some people that is true, but in my case, it did not exasperate. It actually made my leg feel much, much better. So I continued to be active as much as I possibly can. And like Cyndi said in our previous video, that you have to stay compliant. So even though I didn't know what it was I was dealing with, I was still staying compliant. So during my research in 2013, I found a Circade Medi wrap, and I realized that this was something I needed to use. So ever since then, I was using this wrap to help keep my compression or keep my swelling down to a bay. And that's what I used when I worked out. And then I decided to put my mindset and my body to the test and see if I could actually do something I've always wanted to do, and that was compete in a bodybuilding competition. And I was 40 years old when I competed in my first bodybuilding competition, and I placed 3rd in overall and 4th in my division. At this point, I did have 2 surgeries. I had a SAPL and I had a lymph node transfer. The lymph node transfer did not take, which was done in 2013. However, I had the SAPL of Dr. Jay Granzo, and that was life-changing for me, as you see in the image. So I thought that everything was going to be good for me. I was going to just keep on thriving. And then I hit another brick wall. As you see in the image below, I started dealing with abdominal and pelvic swelling. And I share a lot of this on my social medias about vaginal swelling, pelvic swelling, and abdominal swelling. So what I believed happened was in 2020, I got COVID 3 times. And when I would bend up and down, I would feel the fluid moving in my chest. And then I was on an inhaler, which I never had breathing issues before in my life. And I was always tired and lost a lot of hair. So we thought it was long COVID. From what we found out, and the test that, and the next slide, I'm going to show you some testing I did. It wasn't just long COVID that was affecting me. The COVID, and this is hypothetical, COVID exasperated what was already living within my body, and that is a central lymphatic leak. And that fluid I was feeling when I moved up and down wasn't long COVID, but it was lymphatic fluid coming from my central lymphatic leak, which was in my thoracic duct. And so what happened was, when that fluid moved up and down, not only does it move up and down in your chest, but it fluctuates between, it reflexes between your abdominal area, your chest, and my legs. So now I officially have swelling in both legs. I have lymphedema in my left leg now, and I have the swelling in my pelvic and abdominal area. And again, it wasn't COVID that caused it. It was COVID that kind of exasperated what was already there, which also explains when I was born, the entire right side of my body was twice the size of my left side. So in theory, everything's connected, and there is a starting point of what happened and why it went haywire. So I started to navigate things that options, treatment options, what could help me. I did go to UPenn and had an MRL done, and I was told there that there was nothing that could be done for me surgically at this time in the United States. Well, just like everybody else, that didn't sit well with me, so I continued to go on this fact-finding journey. I found out that nutrition and compression and movement obviously works for staying compliant with lymphatic drainage and your lymphedema. However, at that time, nothing was holding me. My nutrition wasn't helping, my compression wasn't helping, and movement wasn't really helping a whole lot. So my quest for understanding why led me to a journey where I never thought I would be, and that was in Europe. So here is the test of the MRL that was done. And as you see, they injected dye into this lymph node. So the needle was very long, and then they injected the dye into the lymph node to see where the dye would go. And what we found out was that I have a complete blockage on both my left and right side in my pelvic area, and I had a leak in my chest area. And again, that explains the swelling in my left leg now, and of course the abdominal and pelvic area and the vaginal area. Pretty frustrating that there was nothing they could do at the time, but there is hope, and I will share that with you. Again, here is where the dye went, and you can see that the obstruction on both sides is there. However, more on my right side than my left, but you do see the blockage, and you do see some of the dye up in my pelvic area, but then it stops. So in order to have this test done, they say you have to eat a high-fat food, such as ice cream, cheese, or anything like that. And what I've learned from this process is that high fatty foods do not do well with me. The moment I eat a high fatty food, I expand. So this was another confirmation that nutrition is a huge trigger for my lymphedema and my lymphatic swelling, or my lymphatic health. So when I went to Europe, I got to spend time with the Whitlingers, and I was able to receive 3 weeks of therapy to see if I could get this new diagnosis and swelling under control. So I was really astonished and shocked with my findings and how I was able to resolve some of these issues while I was in Austria. And that is Mrs. Whitlinger and May. We were at a conference, and she is still as witty as she was when she was younger, and she's an amazing woman. And people like her are the reason why I continue to do what I do. Uh-oh, the video. So there was a video and a picture here of me using a sound bowl. I don't know what happened to it, but let me explain to you. One of the therapists at the Whitlinger Clinic had these sound bowls that they would use on me. And for the first time, when I went to visit, she took the sound bowl and she hit it. Now, she did not have my MRL results. She didn't know a whole lot about my history. She was just there to treat me. So I kept quiet because I wanted to see what she would learn about my body. So we put a sound bowl on my chest and one on my stomach. And when she hit the sound bowl, it went dung and it stopped. Now, if you've ever seen Tibetan sound bowls, when you hit them, the vibration continues to move through the room and it lasts a while. Well, every time she would hit it in my areas that I was actually blocked, it would not vibrate, nor did I feel the vibration through my body. And so I started to, like, well, what's this really going to do? Is this really going to help me? And it actually did. The vibrations in the sound frequencies produced by the bowls are thought to resonate with the body's energy and promote the relaxation, which also promotes stress reduction and overall, well-being, which then brings down your cortisol levels and brings down the inflammation in the tissues. So when she was creating these vibrations in my body, it was actually starting to open up my lymph vessels like this. And at first I did not feel it until the second week I was there. She put the sound bowls on my body again, and she started hitting them, and I felt the vibration from my head to my toes. You could hear the vibration sound all the way down the hallway, where one of the other therapists came in and said, "What are you doing?" And she was like, I'm blocking her. And I tell you, this day when she did that was the first time I also got sick. Right after my therapy, I vomited. I went and vomited. I was sick, and it wasn't normal vomit. It was lymphatic fluid. And she said, this is normal. This is your body getting rid of these toxins. And so I love this so much that I called a therapist here, and Karen Ashforth, and I said, do you have sound bowls? And I purchased 3 sound bowls from her, and I do use this as a form of therapy at home on my abdominal area, and I love the sound bowls. Oh, thank you. I was looking for it. So here's where she's using the sound bowl on my body, and again, it was such an amazing experience that I had to come home and purchase some myself. The other thing I did, I don't know what happened to these images. They were just here earlier. The other thing I learned about movement in Austria was the importance of Nordic walking. Now, I did not take this exercise seriously, and I'm just being very honest with you. But I did not know what I know now. And this walking technique not only is great to help provide assistance with mobility and stabilization, but it actually uses almost every muscle in your body. So when you're moving, there's a certain way you move, and there's a certain way you grab the poles and let them go as you're moving. And what this does is promote lymphatic drainage throughout the entire body, starting with here, your armpits and your abdominal muscles. And when you're breathing and you're moving, you start to feel the lymphatic drainage as you are walking through the mountains and just being in nature. So it is such a great workout for someone who doesn't really want to be in the gym a whole lot, or doesn't, want to do an intense workout, because moving lymphatic fluid does not have to mean that you're in the gym throwing weights around. As we've heard throughout this weekend, it could be breath work, exercise, yoga, rebounding, but so is Nordic walking. It's one of the most amazing exercises that I could not talk about more, for someone who just wants to learn how to move their lymphatic fluid naturally. There it is. So we had to learn how to do this, and it was amazing. It was so much fun, and it's just an easy workout for anyone to do. If you can do it stationary and just move your feet and arms, and you don't have to really go in the mountains. You can learn how to do it, but it's pretty incredible. The other thing I learned when I talked to you guys earlier about nutrition was that I didn't have any of the triggers or inflammation triggers that I had here in the States, that I didn't have those in Europe. I was able to eat proper fat, meat, a well-balanced diet. But what I noticed was that not only was a different way things were processed there, but I also noticed that a Mediterranean diet worked better for me personally. And so ever since then, I've incorporated that into my lifestyle at home, and it's been able to keep my tummy swelling at bay for the most part. There are some days I still extend and look very extended in the stomach, but I see that this type of diet really works well for me. And I don't really like to use the word diet. I should say lifestyle change, because I love to eat. And this is a picture of me doing what I love to do best, and be in the nature. The interplay between stress and lymphedema, we all understand the connection. The relationship between stress and swelling can be connected. While stress might exacerbate lymphedema, living with lymphedema can also be a source of stress, emotional and physical, and financial. So if you can get out in the nature and just kind of decompress and de-stress your life a little bit, it does wonders for not only your mental health, but your physical health. And it just improves, for me, overall, just lymphatic health and well-being. And here are the results. So this was my leg after 3 weeks of decongestive therapy at the Whitlinger Clinic, changing my diet, my food, movement, reducing my stress, which we all wish we can do, but we work and everything else. So there's different things I brought home into my daily life from Europe. But overall, I lost quite a bit of fluid, as you can see. And I have a lot of skin, and we love skin. We love skin. And one of the new things that I also learned was, for my foot area, we use a lot of kineso tape, which my leg and my foot seem to respond very well to. And I was really happy with these results. And once again, I had a kneecap. So my conclusion is that I learned a whole lot from the Whitlinger Clinic. I understand different techniques of the deep tissue manipulation, the abdominal compression, water therapy, pumping, breath work, and the Tibetan singing bowls, which we've all kind of covered over the weekend. The outcome was a significant improvement in my abdominal and pelvic area and in my right leg. And it was a necessity to change the way I ate, because I don't know if I mentioned this, but high fat intake also produces high chyle production in my body. And some of my detox symptoms was discomfort. I vomited and had a headache. All the things we talk about in manual lymphatic drainage or in our CDT phase 1, different things that we do, even when we're pumping. So even though this is not a cure, and we get stuck on some treatments that will hopefully work for a lifetime, I often say this: our bodies change, and so will our treatment options. What may work for you one day may not work for you for the next. And I know this is frustrating, but if you can give yourself a little grace, and give your body a little grace, and just learn to listen to it, it will help ease the journey a little bit. But it is a lifelong journey. It's not a sprint. And if there's anything I can do from a patient perspective, I will help you with. But the one thing I can say is echo what Cyndi said in the last video is compliance. It makes your life so much better as far as you feeling better. And that is it. That's it. I'm at the end.
Great. Thank you so much, Amy. Every time I hear, your story, it's just, there's just so much power in advocacy, advocating for yourself. And it can be tricky, navigating the healthcare system for anyone, whether you're a healthcare professional or, a person who's not in healthcare and just a patient. And so, I think that's really so important. And it's so important to have a connection with a lymphatic therapist and find a, physician that is knowledgeable about lymphedema and have, maintain those connections and have those important conversations that if you're feeling like, therapy is not working the way that you're receiving it, that you are looking into, what else can be done. Certainly, we covered complete decongestive, therapy over the weekend and really, that's the gold typical treatment for most patients, but that, there's so much more that we could cover, with surgery and alternative treatments, modalities, things like that. So, we are hoping to bring more and more of this, but one of the questions is how can people find you on social media?
Oh, I'm everywhere. No, you can find me under Instagram, Thrive with RHS. I think all of the handles are Thrive with RHS. Rivera Hybrid Solutions. I think I have every social media when I don't know how to run them all, but you can find me on TikTok, Instagram, Facebook, YouTube, or you can just look us up at riveramethod.com.
Excellent. Yeah, and can you explain, I mean, I know you touched upon it in your presentation, but when you started feeling those symptoms in terms of your abdomen and such, what did your physicians say? What was the response when you went back and said, these symptoms are happening, what is going on?
Oh, I'm gonna be very honest. They didn't know. Even my lymphedema physician was like, this is kind of rare. You didn't have a surgery that would cause this because they think that to have a central lymphatic leak, it's caused by surgery. And even if you look up, what it's caused, it says normally surgery, but it's not the case. I was born with this leak. So I, once again, had to advocate for myself and say, this is what I'm finding. And so they helped me with getting certain tests done. One of the big telltale signs for me was not just the extension of my stomach, but I also had chyle leaking from the vaginal area. And I talk about this openly, on social media and with other people, because what I noticed is when I would eat a high fat diet, or it was my time of the month, I would extend, and then when I'd go swimming, my extension would go down, but then I would leak that chyle. So my body felt overloaded. It felt stiff. It felt hard. You ever eat a whole lot, and like Thanksgiving, and you got to undo your pants? That's if I eat a piece of cheese, And so I really noticed different things that I was eating was causing this. And so I went on the fact-finding mission because both my therapist and my physician honestly didn't believe me. They didn't really understand what I was saying. They're like, you didn't have surgery. So.
Yeah. And just for everyone, I mean, central lymphatics is something that has been known, but we're really learning more about, we're in terms of clinically and professionally, so there are still a lot of people out there that don't know what lymphedema is, but then you talk about some central lymphatics and and that's even less. And so hopefully through, you know, more education for, you know, the community as well as the professional world, we can continue to learn more about this and know about it, how to diagnose it early and things like that. But, you know, if you have any concerns about any of your symptoms that you're having, it's not necessarily a central lymphatic issue, but, you know, always is, and, you know, I think, you know, Amy said this earlier, but talk to the person that you know you can talk to about your lymphedema and have those conversations, ask those questions, because that's so important.